Hi guys, today we're going to talk about acid-base. Acid-base. Acid-base is difficult for most people. After this talk, hopefully it will not be difficult for you. First step in acid-base is the information that we need. That information includes an arterial blood gas, the pieces of the arterial blood gas include the pH, PCO2. We're also going to need the Chem 7, specifically the sodium, the chloride, and the bicarb. Okay? The first step to all acid-base problems is the clinical piece. In terms of the clinical piece, the question is, what's going on with the patient? Does the patient have vomiting? Does the patient have diarrhea? Does the patient have low blood pressure? All of these things will change the acid-base milieu, if you will. Vomiting, you will lose HCl, or acid. Diarrhea, you will lose bicarb in the stool. And low blood pressure, you will produce lactic acidosis. Which will make your bicarb decrease as you buffer that acid. The second step is to look at the pH. Does the patient have a pH greater than 7.4 or less than 7.4? If it's greater than 7.4, then they have an alkalemia. And if it's greater than 7.4, less than 7.4, excuse me, they have an acidemia. So again, first step is the clinical. We're looking for specific things in the patient presentation, which will give us a clue as to what's going on. The second step is the pH. And now, from the clinical piece to the pH, we have some sort of idea of what type of problem that we have. The next step is our primary problem. Our primary acid-base problem. So the primary acid-base problem is going to be essentially the relationship between the bicarb, PCO2, and the pH. So if you have a low pH, less than 7.4, and you have a bicarb that's less than 24, then you have a metabolic acidosis. Let's say the bicarb is 40, normal. So our primary in this particular scenario is going to be a metabolic acidosis. The next step is to look at what our compensation is for the primary problem. So if, for instance, the primary problem is a metabolic acidosis, which we have in this particular scenario, then our compensation will be for the expected PCO2. Because if you have a metabolic acidosis, and I'll write that here, metabolic acidosis, you're going to need to change your PCO2 so you can get rid of acid. So our expected PCO2 is calculated by a compensation formula. And we will go into the compensation formulas in another talk. The next step is to look at the anion gap. The anion gap is the difference between measured and unmeasured anions and cations. So we calculate our anion gap by looking at our sodium, subtract our chloride, subtract our bicarb. And the normal anion gap, Ag for short, is about 10. If the Ag anion gap is greater than 20, then you have a high anion gap metabolic acidosis. The next step, and the hardest step for most people, is not that hard at all. It's called the delta-delta. And what it is, it's the delta anion gap over the delta bicarb. We should have, for every one increase in anion gap, we should have one drop in bicarb. An anion gap is produced in most cases, anion gap from lactic acid or keto acid. This acid is going to be buffered by this bicarb in about a 1-to-1 relationship. So the normal delta-delta is 1, 2, 2. And if it's above or below, you may have a non-gap metabolic acidosis in addition to whatever your primary problem is, or you can have a metabolic alkalosis in addition to your primary problem. That's it, my friends. Those are the 6 steps. So in review, we have our clinical stem, our pH, so greater than 7.4 with an alkalemia, less than 7.4, an acidemia, our primary problem, and in this case we've done bicarb less than 24 with a PCO2 of 40 and a pH less than 7.4, so in this case we have a metabolic acidosis. The next step is a compensation for that primary problem, and the compensation in this metabolic acidosis is we're looking for our expected PCO2, and this is a particular formula called the Winters formula, 1.5 times the bicarb plus 8 plus or minus 2. And we'll go into these formulas in another talk. The next step is to look at the anion gap. And again, the anion gap is simply the sodium less, so the sodium less the bicarb and chloride. And if your anion gap is greater than 20, then you have a high anion gap metabolic acidosis by definition. And then the final step is the delta-delta. And the delta-delta is simply the change in anion gap over the change in bicarb. The delta-delta can be calculated as such. The delta-delta equals the change in anion gap over the change in bicarb, which is equal to the anion gap that you calculate less 10, which is normal, over normal bicarb, which is 24, less the bicarb that we determine in our Chem 7. Okay? That's it, folks. Next talk, we'll do some examples.